Hi squad, Pharmacist Geek here. How are you doing today? I wanted to start off by saying thank you for supporting my channel, supporting me, but please let me know what you want to see in the comment boxes below. It really will help me to sort of decide what content to produce, what everyone wants to actually see. But anyway, today I've got a video on depression. We'll be focusing on the main pharmacological drug class which is used, and sort of the main overview, important points that I think you should know. With depression, non-pharmacological intervention is usually the first-line treatment, unless cases are more severe. It's good to be aware of the non-pharmacological interventions which are available for patients. One of the best places for this is NICE guidelines. So which medicines are our first-line options? As most of you probably know, it's SSRIs, which stands for selective serotonin reuptake inhibitors. These are the most commonly prescribed medicines in depression, and that's just because the safety profile is well understood and compared to other options is a lot safer, which is why it's a natural first choice. So what I'm going to be doing in this video is giving you an overview of different facts about SSRIs, different important points, counselling points, which I found useful in my practice, found useful for the exam as well. So this one's a bit of a fun fact, but fluoxetine is the only drug which is licensed to be used in under 18s, which is really strange because I always see sertraline prescribed. So if anyone knows why, if there's a reason behind this, please let me know down below. Be interesting to know. There is a little caveat that before fluoxetine is tried in under 18s, that a non-pharmacological intervention must have been tried for it to be licensed. Moving on to adults. In adults, the first line choice is citalopram or sertraline, as they have the fewest drug interactions. However, we need to be a bit cautious with citalopram because it can cause QT prolongation, which in certain patients is best avoided. Patients who already have arrhythmia, patients who are on another medicine which increases QT prolongation. It's important to avoid having patients on multiple drugs which can increase QT interval. So let's talk a little bit about the problems with SSRIs, things to be cautious about. So they can increase the risk of GI bleeds. By themselves, it usually isn't a problem unless there's other risk factors present. So like being elderly, on concomitant use of NSAIDs, that sort of thing, that's what you want to look out for. If a patient is coming in for NSAID treatment over the counter in a community pharmacy, it might be best to see if paracetamol would be more suitable, or to discuss a risk and just to recommend them to use it for the shortest time possible. SSRIs can cause hyponatremia. So this is when your sodium levels drop too low. It usually presents itself as confusion, lack of consciousness, or a reduced consciousness I should say. It's more likely in elderly. One of the more rare but very, very important to know about risks and side effects is serotonin syndrome. So this is where you have increased serotonin levels in your body, which is usually due to being on more than one serotonergic drug. So other serotonergic drugs include tramadol, the cough suppressant dextromorphin. It's one of the only ones recommended by NICE for coughs, but on patients on SSRIs it's best to be avoided. In more severe cases, it's seizures, arrhythmia, unconsciousness. You think for patients having severe symptoms, it's best to call 999 and refer them straight away. So let me go over some counselling points with you. So number one, antidepressants take time to work for symptoms to start to improve. They are not addictive. Do not stop the medicine abruptly. Patients should be aware of a chance of worsening of symptoms initially. So this is important to know because patients, when they're starting medication, they need to be able to make informed consent on the risks, the side effects, the possible benefits, or possible things which may go wrong. And they need all that information to decide if that's treatment that they want to start. And then once symptoms have improved, the drug treatment should be continued for 6 months until being stopped. And this is to reduce the risk of relapse. And the last point I wanted to say was before switching to a different antidepressant drug class, usually a second SSRI will be used, and this is like what I said at the start of the video. It's due to a vastly superior sort of safety profile. So if a patient was tried on citalopram, they would usually try sertraline or whichever combination it may be. And guys, this isn't an exhaustive list of everything about SSRIs. Like I said, it's an overview of the whole, but these are some of the main points that I would learn, some of the most important. But again, thanks for watching the video. Like if you enjoyed the content, subscribe and hit the bell icon to see my future content. I've been Pharmacist Geek and I'll see you soon.